The term obesity originated from the Tuscan general Alessandro del Barro in 1645, and it means overeat, or being very fat. Obesity is a common pathological process in humans, driven by genetic and environmental factors, and is now a global pandemic with serious health consequences. Body mass index, or BMI, is a measure used to categorize individuals based on their weight and height, ranging from underweight to extremely obese. Obesity can result from consuming more calories than burned, unhealthy eating patterns, certain diseases like hypothyroidism, and lack of physical activity. Obesity involves a positive energy balance where energy intake exceeds expenditure, leading to lipid overflow and increased risk of cardiovascular diseases. There are two types of obesity: apple type and pear type, each with different health implications. Apple type obesity is associated with higher health risks due to central fat accumulation, while pear type obesity involves fat distribution in the lower body. Obesity can lead to numerous health issues, including hypertension, type 2 diabetes, heart disease, stroke, and mental health disorders. Investigations for obesity include lipid profiles, liver and kidney function tests, complete blood count, and BMI measurement. Anthropometry measures human body variability, including height, weight, and other physical dimensions, to assess health and nutritional status. Differential diagnosis for obesity includes conditions like ascites, hepatomegaly, and pancreatitis. Fasting, including short and intermittent fasting combined with calorie restriction, is an effective method for reducing body weight and fat. The body alternates between states of eating and fasting, affecting insulin levels and fat storage or burning. Fasting impacts various body systems, including the liver, skeletal muscle, and vascular endothelium, promoting fat oxidation and reducing inflammation. Amylin regulates body weight by influencing gastric emptying, food intake, and other metabolic processes. Consistent force on bones leads to osteoclastic activity, breaking down bone, and osteoblastic activity, building up bone. Fasting methods include juice diet with various fruit juices and breaking the fast with eliminative, soothing, and constructive diets. Supportive naturopathy treatments for obesity include massage therapy, hydrotherapy, and yoga practices like kriyas and pranayama.